serving the armed forces, was that when you became aware of PTSD and the veterans and the whole issue of mental health when people leave the forces and mental health in general?
Yeah, I think so. I mean, so when I was growing up in quite a sort of strange home environment, a lot of my family were affected with a few mental health problems, so I was aware of them. But yeah, largely, I think when you go through conflict, you see people clearly get injured, and people get injured in mind as well. And one of the things that kind of drove me into this, I had quite a varied military career. I did, at the very tactical level, sort of ground holding stuff in those early days in Afghanistan, where you may have seen the platoon houses and things in the news. Right up to the sort of strategic level, operating in the UK Special Forces group, where you're going after the sort of higher levels of Al-Qaeda and the Taliban, trying to dismantle their networks. And it's during that period that I remember that I was briefing ministers on some of the operations we were doing that were quite sensitive. And I remember looking at them and thinking that they could, I could say anything I wanted about the operation. I could say, we're going to run out the back of the Chinook in chicken suits. They wouldn't say anything, but they got to make the decision because they were elected. And then when I saw so many guys getting injured and killed and so on, and then how they were looked after when they came home, that was the real sort of crux of it. That really drove me towards where I am today.
Because that is something, that's one of your, I was looking at the social media accounts over the past few months, the care of not just veterans, but people who suffer from mental health or something.
Yeah, I think mental health is one of the great tragedies of our time, because we're still in a place now, where people apply themselves to understand mental health and what's required to make sure you have palliative provision and so on. But generally only if it's affected someone they know or if it's affected themselves. Now, you wouldn't accept that for cancer or any of these other issues. And I just think that we have massively under-prioritised it for a long time. We've come a long way. If you look 100 years ago, we were executing soldiers for having shell shock. We have come a long way, but you're starting at a really low base. And even with the massive effort that is going on at the moment, I think next year we'll slip from reaching 1 in 4 with a mental health problem to 1 in 3. So there is still a massive unmet need in the UK, and a long way to go.
And more funding is required?
Of course, more funding is required. I think we've got to be a lot smarter around it as well. I've been, there are some wonderful voluntary groups in this country, whether it's to do with veterans care, mental health, or whatever it is. The key is that they have to work in sync with each other. If you're duplicating services, if you're not practicing evidence-based care, if the charities aren't really having an outcome, we need to ask some pretty stern questions and find out what's going on. I think the government should be there to provide a little bit of regulation, a little bit of control over the sector, but we've now got 3,500 military charities. There's billions of pounds in the military charity sector, and yet there are still veterans whose needs go unmet. And that, to my mind, speaks to a need for quite serious reform.